So, Alan, you don't feel the pain just back here. It's
Well, that
actually,
I'm just talking about right this moment.
yeah. Well, and I always, yeah. It's like, so if even if I was there and I did a session on you, I would find out where you hurt now and work on that
Yeah.
now. And then the next time, like if I saw you tomorrow, it might be a little bit different. And then I would work on that. Does it make sense? Like it kind of changes things. But instead of just feeling it up in your upper thoracic up here below your neck, you actually feel it down. Is it just the left arm?
Yes.
Okay. Is it always down the left arm?
Yes.
Okay. When it goes down the left arm, does it always feel like it's in the posterior on the back side?
Yes.
Okay. Hmm. All right. So we're going to do something real quick. I want you to watch this, okay? Because I'm going to have you do this to yourself, but I'm going to teach it to you at a distance. I'm trying to figure out what's going on. The area you have problems with is like 80% of the clients I see have some sort of problem with their upper back and neck. Doesn't matter if they're former military, doesn't matter if it's a guy who just codes, he's a code monkey, he's just coding all day in Austin. Everybody's got problems with their upper back and neck. That's like 80% of what I see. When you have the pain running down your arm, does it go to your fingers or your fingertips?
So it's weird. The pain does go. Okay. So the pain doesn't go down to the fingertips. I'm losing sensation in these two fingers.
Okay,
Yep.
more like radial nerve is what it's making me think. So you got two different nerves. You got a radius and an ulna, two different bones.
Okay.
You got nerves that go down at one side or the other. Usually it'll
Yeah.
split across the hand. Yeah.
Yeah.
And the reason I mention that is just to explain to, if somebody sees this video after the fact, I can reuse this stuff to help educate. The first thing I want to do is a little bit more complex, but I want to see if I can essentially trigger your pain. I want to find out if I can press on a specific muscle and help recreate that sensation that you feel in like a controlled way. And my first guess is, based on what you just told me, is that you have some neck involvement with some muscles called your scalenes. Have you ever heard of these before?
No.
So they're just deep muscles in your neck. Scalene sounds all, complicated, but it's nothing but a neck muscle. So you've got a muscle here called your sternocleidomastoid. And usually people can grab this and kind of pull it away. If you turn your head from side to side, you see how it'll start to protrude right here?
Yeah.
This muscle is the one we're trying to get a grip on.
Okay.
And I want to find that because if I go into the front of the neck, that's how I choke somebody out, right?
Right.
So if I go in front of the SCM, I'm getting close to the carotid artery. The carotid
Right.
artery is something I want to avoid.
Yes.
For obvious reasons. But
unless you want a really bad headache.
Exactly. I've seen this in like Brazilian Jiu-Jitsu videos, by the way. A young lady put a guy in a chokehold and the guy passes out and her coach comes over and starts smacking her, tapping on her to get her let go. And he grabs the guy's feet and lifts him up to push blood back into his head because he was starting to pass out.
Yeah.
But they're controlled. They're martial artists. They deal with this daily. So it's something they're not afraid of. So I don't want you to press on the carotid, but here's what's going to happen. On your left side, you're going to use your left hand. I'm going to do this with you. I'm going to take my thumb and come in like this on my neck, like putting my hand on the back of my head.
Okay.
And you remember this muscle that pulls away?
Right.
Because if you can you feel that muscle right there? Can you actually pull?
Yeah.
I want you
Yeah, I've been messing with it.
I want you to be behind that muscle. So you can see now that my thumb is going right behind the SCM.
Okay.
And I want to go about 3/4 of the way down. And I want you to tell me, as you run your thumb pad back and forth, do you hit something in the front here? Do you see how I'm in the side of my neck?
Okay. Oh, up forward.
Yeah. When you press your thumb down and into the neck, do you hit something that feels kind of tender?
Not along the front, no.
Can you come closer to the camera for me?
Absolutely.
Yeah. And then turn like a little bit to your left side. There you go, because then I can see that guy a little bit better. So reach your arm up, and I want your thumb a little further forward. I want you to come in and find with your fingers, look at what I'm doing. I want you to find this SCM with your right hand,
Oh, well, my right hand.
Yeah.
Oh,
And then I want your left hand to reach that thumb in.
So keep it
Because I'm trying to find both of those because I'm trying to find that landmark. And this is a little complicated. This isn't where I thought we would be going first, but I suspect this is going to help you.
So right behind there.
So once you found the SEM,
okay.
sternocleidomastoid, doesn't matter. You're using the thumb to press back into the scalenes. And the one I want is more to the front. There's 3 of these scalenes. There's one in the back. I want you to be in the one in the front.
Okay, yeah, I'm on the one on the back.
And scoot the thumb forward because you'll start to feel the edge of the SCM right there.
Yeah, it's a little sensitive.
Okay, so here's the deal. Without causing yourself pain, can you press that thumb pad in so that it feels intense?
Oh, yeah.
Okay, now when you press in, do you feel anything other than where you're pressing?
No.
Okay, so I want you to continue to explore and maybe go a little bit further forward. You could go to the front, you could go to the back. As long as we're behind the SCM, totally safe, totally fine.
Pull again with your other hand.
Well, it's right here, Holly.
Behind it and just move back and forth. That way you can find those 3 muscles. You just keep your finger in the same spot and then move it.
So I'm going to do this real quick. I'm going to exit out of full screen. I'm going to pull up a graphic so that I can show you where this is. So you can get like a better visual image of what's going on here. I think this one looks like it'll work pretty good.
That's the back one.
So let me go here and no, that's not what I want. How to full screen. There we go. You there?
Ah.
So
okay.
If you look, this is a cutaway. It looks like they've removed the sternocleidomastoid. It would normally attach up here,
Okay.
and come down and over towards the sternum, like on top. But do you see these little guys right here? This is the anterior, this is the middle, and this is the posterior. I'm trying to get you to the front here. And like I said, there's a cutaway. If I look at this photo, let me pull this up. This photo shows the SCM a little bit better. That's the muscle I'm trying to get you to find so that we can come just posterior to it. Does it make sense?
Okay.
Yeah.
So this would be just posterior to it.
Yeah.
How far up do you want me to be?
Normally, I'm going to want you to be about 3/4 of the way down.
Okay.
Do you see how this muscle right here, do you see how it's almost like halfway and then 3/4 is sort of like the belly?
Right.
Yeah, this is kind of like where I want your thumb, right here. And when you press in, it feels like I'm pressing into bone. This muscle never feels light. It never feels soft. It never feels relaxed. It's sort of a support structure muscle for your neck. But when I press into it, the funny thing is it feels tender where my thumb is, but I don't feel it there. I'm getting referred pain into my shoulder and down my arm.
I'm not getting any of it. I'm not even getting pain from it.
Yeah. And
I mean, other than right where I'm pressing.
let's see if I can open this back up. Let me see. Here's another photo. And do you see this is the anterior? This is the one I'm trying to get you to hit, kind of about right there. This is always the bad boy.
You feel anything?
Oh.
What?
Yeah, that just started sending tingles down my spine.
I think that's the spot because you can relax your neck and find that big muscle here with this hand. Relax your neck and find that big muscle in the front first.
Okay.
The big one, the regular one, the regular one. You see it there? Okay, hold it with this hand. Pinch with the, not pinch it, but just hold it here and then take this one and then go behind it with your thumb and keep your thumb in the same spot, but you can move towards the front and find the hard bony.
Oh.
Is that it? Right there?
Yeah.
Is it painful, Alan?
It's a little bit, yeah.
Okay.
But I don't know if it's just because I've been pressing on my neck or.
No, that's okay. So mainly,
You try the other side.
mainly what I'm looking for is I'm trying to find a spot which means that you feel referred pain down your arm. And I'm gonna turn so I can just show you the opposite side, just so you can kind of see the angle. It's a little bit more challenging on camera. If I was there, I could just stick my thumb right in it. I know I could. When I turn to the side here, again, you see how the SCM starts to pop up over my thumb?
Yep.
That's just a landmark. What I'm trying to do is get my thumb in, and it feels like I'm pressing back and straight almost into the body of my cervical spine. Now, when I do this, I'll feel, ooh, I went a little bit forward. Okay, I hit my anterior scalene. As soon as I hit it, I feel referred pain into my shoulder joint, and I start to feel stuff down my arm. And I suspect this is involved. Bring your thumb further forward. So turn back a little bit. I can't see from that angle because of your arm.
Oh.
So yeah, just turn and face me a little bit more.
Oh, okay.
There you go. That'll work. So bring your thumb further forward.
Okay.
Bring your thumb further forward. Right there. Start to sink in there.
Uh-huh.
Now, if you ran your finger back and forth,
Uh-huh.
do you feel any tender muscle there?
You want me
Or
to
is it hurting your hand?
Huh?
Is it hurting your hand?
Yeah, a little bit right now.
So, no, and here's the thing. What I don't want you to do is I don't want you to strain your hands. The reason I have you use your hands to begin with is I don't want you to like put yourself in a position where you're like harming yourself. Does it make sense?
Okay.
Like I don't show you with a tool because we're digging like in a very sort of delicate area in your neck. Like I wouldn't want you to come in with a tennis ball right here. Does it make sense?
Okay.
Now, the other thing is, in my case, I can use a couple of fingers. I can switch out of the thumb and move to this.
Right.
Okay.
And then I'm going to find, because here's the board of that SCM.
This is it, right? Right here.
I think.
Yeah, that's the main muscle.
That's the SCM. You're just posterior to that. When your thumb sinks into the right spot, that muscle just like sits on top of the thumb.
Right there. Do you want it lower? Or?
Just slightly lower. And then I want you to gently, with the thumb pad, can you just press into his neck? It almost feels like you're pressing back and in, like into his spine.
Harder.
I don't feel muscles moving. It just feels like one spot.
Mm-hmm. The muscles are so dense side by side, it's almost impossible to differentiate them at first. But once you know how to do it, if I had him on his back, here's what it looks like. If I had him on his back and I was cradling him, and I had my hands on your neck, my thumb looks like it's digging down into your throat. That's what it looks like. It's like I'm pressing back and in. If I'm doing it from behind, it's almost like I'm grabbing this claw and then pulling back and into his neck and really leaning into that muscle.
Yeah, right there.
Yeah.
What do you feel?
Just a little bit of pressure.
Right on that spot?
Yeah, and a little bit of pressure shooting down my forearm. But
so when you say you feel the pressure down your forearm, is it like she's hitting that spot and then all of a sudden you feel this referred pain down the arm?
Right in here.
Does that feel like the pain you were telling me about?
Not as severe as, but yes.
Should we try it where you're laying down and I'm
No.
But
he's not used to sitting on the floor either. He's usually on a computer chair.
Yeah, no, so we just work on it slowly. Now, that's a little bit more complex than normally what I would start people with. That's normally not what the first thing I would go to, but because that's what I think you're having problems with, I just wanted to make you aware of it. I can help you work on the surrounding structures. What I think happens is this. Those muscles cover some major artery supply that goes down your arm and some major nerves. But that's a trunk that those nerves come out of your cervical spine and go down your arm. People come to me all the time, tell me they have carpal tunnel syndrome. And I work on them, and I basically got to go up the chain and try to figure out, do they have a crimp in the hose, so to speak? Is something pressing on a nerve and it's referring pain down into their forearm or their hand or their wrist? And it's coming from these nerve trunks. A lot of people, they're at work all day. Those muscles pull the head forward, especially the anterior. It's forming some tightness, and it seems to be innervating that nerve. It's happening up here, but they feel it in their shoulder. I cannot count how many times somebody comes in and says, I have shoulder pain. And I go, where? And they go, right here. And I go, it's not your shoulder, come here. And I press in their neck, and it recreates that pain because it's up in the nerve trunk in their neck. Does that make sense?
Right, yeah. No, that makes perfect sense.
I'm going to help you unwind some of the other tension. I'm up against the wall here, and I thought this would be the easiest way for me to demonstrate. Do you have your foam roll?
Yeah. I do.
Okay. So I'm going to put this behind me and see if I can do this. It's going to look a little different than I would normally do it because you're going to be laying down on your back.
Okay.
Yeah.
And if your head and neck get tired, I want you to be able to put your hands behind your head just to support yourself. Once you get into a good position, you go into your upper back, you go towards the neck. Once you find where it's like, ooh, right there. I want you to put some pillows under your head so you can rest.
Oh.
And if you need to, you can put pillows on the underside, like under your bottom, under your sacrum, so you can rest. But I want to prop you into allowing this to fall back and open. This foam roll is just a big, broad tool that's allowing us to press into our back. It's allowing us to press into those muscles.
Okay. Oh.
Slow.
Found it.
There you go. Prop him underneath his head. Slide the blanket underneath so his head doesn't fall too far back. Is that too high or too low where she put you, Alan?
A little low.
A little low. Okay. Puff it up a little bit. Make it a little bit higher. Can you put another pillow underneath his sacrum, underneath his low back?
Low back, my love.
So scoot it down a little bit lower. There you go.
There you go. Try that.
So Alan, when you come down there, here's what I want. I want a yoga lazy boy. I want you to put yourself in a position where it feels intense, but not painful.
Okay.
So
You can increase those props or decrease those props depending on what you need.
Okay.
I got another pillow ready. Should he have his back relaxed, his lower back, like just resting?
Yeah. So at any time you can make it active, Alan. Like if you want to press your feet into the floor and you want to roll up or you want to make it active, that's fine. I wouldn't want to put you in this position, and I've had somebody do this before, by the way. They put themselves in position with these props and they fall asleep.
Oh, that would probably not be.
Our dog will wake him up.
So what this is doing is most people are in what I call thoracic flexion. What this means is their shoulder blades fall down and close and their chin juts forward.
Yep.
What I'm trying to do is essentially get you to back bend through your thoracic spine and open your chest, because all of this creates the posture that leads up into the neck. How does that feel, Alan?
I mean, it's achy. You know, the arm pain is achy.
Yeah. So,
I mean, it feels like a great stretch.
With the arms, can you put your arms down by your side?
Oh. Ooh.
And when you put your arms down by your side, does it feel like it's not as much strain on your shoulder joint?
Yes.
Okay. Because what I want you to do is to try to focus on this area in the upper back and neck. You can feel free. If you want to move your arms, it's totally fine. It helps you open the chest, but it's like a secondary part. It's not as important as pressing on the foam roll on that area. There we go.
My spider sense is tingling.
Are you getting tingles in your hands?
Yeah, in my left hand.
Okay. Does it feel bad?
The tingling?
Yeah.
No, it feels like it's about to fall asleep,
Okay.
even though I know the blood flow's good.
Yeah. As long as it doesn't get pronounced and worse, like drastically and quickly, sharply, I think it's fine.
Right.
Yeah. Now, as you press into the foam roll, you're pressing into that guy. What happens if you very lightly try to turn just a little bit to the right or a little bit to the left? Which side feels better?
Oh, no, the right, stretching the left shoulder back to my right side definitely shoots.
Okay. So what I want you to do is, within reason, you can make it more intense if you want, where you can kind of come towards that, whoa, but I don't want you to make it, your body's afraid. I don't want it to be painful. I don't want it to be sharp. But if you lean into an area and you're like, ooh, right there.
Yeah.
That's what I want. Yeah.
Okay. I'll leave this. That's too much. Oh.
When you lean where it feels more intense, does it feel like that helps somehow? Does it feel beneficial? There you go. And if you need to, you can sit up. You can come off for a minute.
Yeah.
We have lacrosse balls too.
Uh-oh.
It's achy.
Yeah.
It's achy for sure. But yeah, I think with a little rest, it would probably feel better.
Yeah.
I'm not exactly the lightest person in the world, so to put all my body weight on that shoulder is a bit.
Here's the other thing. Some people have foam rollers that are kind of soft. I never know what kind of equipment have people have. I use one that's really, really firm.
That's what I have.
If you need something, if you need this to be a little more soft, you can fold a towel over it.
Okay.
Because it's going to make, you're pressing into the towel before you hit the foam roll, so it's going to soften it just a little bit.
Okay.
What I don't want to do is I don't want it to just be painful and too sharp and too fast and too abrupt, because people tend to recoil and tighten up. I want you to, just like getting a good massage where the person uses the right tool at the right speed with the right amount of pressure, where you're like, whoa, right, oh, there. So it's almost like you're massaging yourself, right? At the moment, do you feel like you want more? Like, in other words, do we want to use like the lacrosse ball or the tennis ball? Or are we good for today?
I think we're good for today because I'm tingling pretty hard.
Okay. Did it make the tingle worse?
The tingle, yes. The pain, no.
Not the pain. Okay. So when we started, 10's hospital and 0's no pain. What were you at when we started?
Probably just like a 7.
A 7? Where are you at now?
Pain-wise, I'm probably at a 6.
6? Okay. 1 point. I'll accept that.
I think it's something that, I've been living with it for 2.5 weeks. This acute, I've got injuries from the military, but this this acute thing that's been shooting the pain down my arms, specifically for the last 2 weeks. I didn't expect, 10 minutes on a foam roller.
No.
Be like, yeah, you're fixed.
So what I would do right now is you can wait an hour or two, see how you feel, and decide whether you want a second round, where you lay back, excuse me, you lay back on the foam roller again,
Okay.
and really access that same area. Each time you do it, progressively, people can they can take a little more pressure, they feel a little more mobile. It's just like getting a massage. At the end, you're much more pliable. It's much more open. The stuff with the neck, I'd like to go back into that, but I'd like to go on the right side this time.
Okay.
And the only reason I want you to do it is to be able to compare and contrast the left and right side. So I'm going to reach up with my thumb, and again, that SCM just pops out in front, and I'm feeling back and forth, and I can feel that muscle. And when I press into it, I get referred pain right into my shoulder. Now, I don't have as many problems with this right side. I have problems traditionally on my left. And I can pull those graphics up again. Let me see if I can do this. Let's see. Share screen. And here we are. Let me see if I get a better picture of
See it, okay?
this.
Right.
Yeah, they're the structural muscles on the inside.
Yeah, this guy right here is really what we're looking for. The SCM has been cut away. The SCM would be falling right over here.
Right.
But this is the guy we're pressing into. It feels like I'm pressing into your neck. Normally, I know I'm there because when I press back and into the body of the vertebra, I immediately feel referred pain right inside the shoulder joint.
See, I'm not getting any referred pain.
And then I think our positioning is just a little bit off. Let me go back so I can see. You're too posterior. The SCMs, if you look at me, the SCMs connect up here around the ear, and they go down into the front.
Oh, okay. So I am way.
Do you see this red mark on my neck?
Yes.
That's the SCM popping up.
Okay.
I am right in the front of my neck, and you see how I'm pointing to the back?
Yep.
That's where I'm hooking the thumb in, pressing back and in.
Ooh. That's tender.
Now, if you just hold the thumb and just lean in, don't even think about rubbing back and forth now, just lean in. Do you start to get any referred pain down the arm?
I'm not getting any referred pain at all.
Okay. I'm almost positive that if I came there right now, I was right there, you'd go, holy moly.
It's gonna have to be way harder than that for me to get any pain, Holly.
And then when your fingers find the SCM, I'm grabbing my own SCM right there.
It's right here.
Yeah, I'm just behind that. Do you see how? Yeah, do you see how my thumb is right next to it?
Oh yeah,
that's a little sensitive.
you did. I guess that's the spot.
You okay, Alan?
Yeah.
There you go.
Right there is the
SCM, sternocleidomastoid. So when she presses in there, Alan, what do you feel?
How far down? Just right that spot.
Usually it'll start about halfway and go down towards the collarbone. You okay, Alan?
Yeah, I'm good.
This is not show your wife how to choke you out.
Right?
Any referred pain down the arm when she presses?
No, just tenderness on the muscle itself.
Okay. So listen, on the left side later, you can practice again to see if you can find that area.
Up forward?
Yep, and as long as you're not in the front, we're safe. Because you don't want to go towards the throat, you don't want to go towards the carotid. But as long as I'm behind that SCM, I can put my fingers in here and feel. I can rub the finger back and forth oh, right there. Like I feel that referred pain into my shoulder. I think that's where some of that tingle down your arm is coming from. That's my best guess from working on people for years. So go ahead today. You could do that one more time just to see if you could find it later once your muscles calm down. And then the foam roll, you can use that. Are you around tomorrow?
I am.
Okay.
Tomorrow, he has 2 o'clock. He has a telehealth appointment.
Yeah.
That's it.
Okay. So a telehealth appointment, you said?
Yes.
Yeah. So could you do like noon, 1 o'clock?
I could, yeah, absolutely.
Okay. Noon, 1 o'clock, let's do this again. I'm going to walk you through like another spot, like maybe get into the lacrosse ball or the tennis ball. Just do the foam roll and the stuff with the scalene one more time today. I just want to find out how it feels tomorrow, even to reduce you by a point on a pain scale and give you some education. This is exactly how I work with clients. It's much more effective when I'm hands-on because you could feel it. I could just go right to that muscle and make you more aware of it. But I really think that's where some of that arm stuff is coming from. It's basically this: people's shoulders roll forward, their chin juts forward, and it's compressing these nerves out of people's necks that go down their arm. That's the easiest way for me to explain it.
Okay.
If tomorrow at 1 o'clock works for you, I'll be on lunch at that time and I can join it.
Yeah, no, that'll be great.
Okay.
All right, sweet.
Cool.
Well, thank you so much for everything for today.
Thank you.
You're welcome. Thank you for your service.
Thank you, sir.
You have a great day.
All right, see you tomorrow.